We just adjourned a meeting that we've had with some of the area small business owners. Many of these individuals are members of the NFIB, the National Federation of Independent Businesses, and our major topic of discussion this morning was House Bill 3200, the much talked about health care reform bill that is moving through Congress and that is being debated here in our community as well as across the country. I thought it was important to help explain to some of the small businesses who've inquired with my office and how this bill is going to affect them as small business owners as well as them as individuals who have insurance either for themselves or who provide it to their employers. Now, as you know, they've kind of caught on around the country. Since that time, we've also done a series of tele-town halls. I've met with any organization that sought a meeting with me. We've met with both labor groups and business groups. We've met with advocates for single-payer system. We've met for advocates of the private system. The fact of the matter is, people are hurting. Individuals who are trying to get health coverage, businesses who are trying to do the responsible thing and providing health care coverage, and individuals who have a pre-existing condition that can't get health care coverage are looking to us for answers. And I want to make sure that the solution, that the change that is enacted does not undermine the great quality of care that we enjoy in our country. I don't believe the answer is for the federal government to take the system over. I don't believe that the federal government running our health care plan is going to make it more efficient, is going to make it more cost effective, or is going to provide for better patient outcome. To your point about individuals who don't have care, the reality is that independent groups that have looked at House Bill 3200 have all said that hundreds of millions of Americans will lose their private health, employer-based health insurance plan. This bill contains an incentive for businesses to drop their employer-provided health insurance plan and instead allow their individuals to go on the public option. Now, it doesn't mean these individuals won't have health insurance, but they will have a government program. I don't believe that the government is the answer and that a takeover of the nation health care plan as what I think is contained in House Bill 32. Every country that has adopted a program like House Bill 3200 has resulted in poorer outcomes. I'm going to be traveling down to Quincy and in Jacksonville and in Springfield later this week, in Decatur. We're going to continue to engage the community, whether it be with business and labor leaders or individual town hall formats, whatever the public would like. Everybody has the right to weigh in to his or her elected official, and they should do that. There are Democrats who have valid concerns with their own party's proposal. There are Republicans who have truly creative ideas. I want health care reform, but that we stop this very take it or leave it, my way or the highway, one-party approach that we've seen in the first 6 months, and what I hope the President is hearing around the country as he has his town hall meetings is slow down. Wait a minute. Allow me as the American public to read this document, understand what it does, and allow me to weigh in as my right as an American to my elected official on what I like about the bill and what I don't like about the bill, so then we as elected officials can do our job in offering thoughtful amendments that were brought forward by public that we represent and weigh those options before we vote on a bill. That is how democracy should work, and I believe the American